Every 40 seconds, someone over the age of 60 in America suffers a stroke. Did you know that the very medications you take every day could be increasing that risk without you even realizing it? Hello, I am Dr. Sam Wells, a 50-year-old physician and specialist in senior health. And today, I want to sit down with you and talk about a deeply important topic. The common medications many older adults use that may quietly increase the risk of stroke. In over 20 years of working directly with elderly patients, I have witnessed many cases that could have been prevented if people had understood the hidden mechanisms of danger. There are groups of drugs, from pain relievers and blood pressure medications to vitamin supplements, that may seem harmless, but can actually affect your cardiovascular and brain health. Not all are dangerous, but understanding how they work will help you make smarter decisions for your health. In this video, I will share 10 groups of common medications you should be cautious about, explain the harmful mechanisms behind each one, and, most importantly, show you how to prevent stroke naturally and safely. This is not just medical information. It is also the practical experience I have gathered over years of caring for older adults. If you care about long-term health, please subscribe to this channel and share this video today. The information you learn now could save you or someone you love from a risk that is entirely preventable. Every day, thousands of people over 60 in America face the danger of stroke. Recent statistics show that every 40 seconds, another older adult suffers a stroke. What is most concerning is that many of these cases are not only related to age or diet, but also to the medications they are taking. Prescription drugs, something we trust to keep us healthy, can sometimes become a double-edged sword if we do not understand how to use them correctly. From my experience as Dr. Sam Wells, after more than 2 decades working with seniors, I have found that most patients do not realize that certain everyday medications may increase the risk of stroke. These medications are not always dangerous, but if you already have risk factors such as high blood pressure, diabetes, or high cholesterol, they can become triggers. So what makes them dangerous? Many medications directly affect blood pressure, causing it to rise or fall too drastically, which puts sudden pressure on the blood vessels in the brain. Some interfere with blood clotting, either thinning the blood too much or causing it to clot excessively, raising the risk of blockage or brain bleeding. Even medications that affect heart rhythm can cause irregular heartbeats, leading to the formation of blood clots that may trigger a stroke. In addition, certain diabetes drugs, when misused, can cause severe hypoglycemia, which affects blood circulation in the brain. I often tell my patients that understanding how a drug works is like knowing the flow of a river. When you understand the current, you can build safe dams to prevent flooding. In this case, understanding medication mechanisms helps you choose the right drugs, the right doses, and combine them safely. A small step such as consulting your doctor before changing medication or adding supplements can significantly lower your risk. Here is a real example. One of my patients, Mr. John, 67 years old, had high blood pressure and often took painkillers for joint pain. He did not realize that certain non-steroidal anti-inflammatory drugs, NSAIDs, can increase blood pressure and interfere with blood clotting. When combined with blood pressure medication, his risk of stroke rose significantly. After adjusting his dosage, changing some medications, and closely monitoring his blood pressure, his risk decreased. This is just one of many cases where understanding how drugs work has saved elderly patients from unnecessary danger. Knowing the mechanisms also helps you take charge of your health. You will learn to recognize early warning signs, such as dizziness, unusual headaches, vision changes, or weakness on one side of the body. When you combine these symptoms with awareness of the medications you take, your doctor can better assess stroke risk and intervene in time. So my message for everyone watching today is this: understanding how your medications work will help you choose safer ones and reduce the risk of stroke significantly. This is not just medical advice. It is a way to protect yourself and your loved ones. Your health is a journey, and knowledge is the most valuable map to guide you safely along the way. Let me emphasize once again, before starting, changing, or combining any medication, always consult a qualified doctor or pharmacist. This not only reduces your risk of stroke, but also helps you maintain a vibrant, healthy, and confident life well into your 60s, 70s, and beyond. If you find this information valuable and want to protect your own health and that of your family, please subscribe to this channel and share this video today. The information you learn now could one day save your life or the life of someone you love. 10 common medication groups that increase the risk of stroke. 1. NSAID pain relievers. The hidden stroke risk. When it comes to pain relievers that most of us use daily, it is impossible not to mention the group known as NSAIDs, such as Ibuprofen, Advil, or Naproxen. These medications are very familiar and often seen as saviors whenever the body aches, especially for bone and joint issues, back pain, or arthritis. But from my experience, Dr. Sam Wells, after working with hundreds of elderly patients, have found that long-term or excessive use of these drugs can lead to risks that many people do not expect. The danger mechanism of NSAIDs lies in how they affect the body. One of the major issues is that they can cause the body to retain more salt and water than usual. This leads to elevated blood pressure, which is one of the leading risk factors for stroke. In addition, NSAIDs affect the body's blood clotting function, making it easier for clots to form and increasing the risk of blocked brain vessels. That is why people over 60, especially those with cardiovascular or blood pressure problems, need to be particularly cautious when using these medications. I remember one patient, Mrs. Linda, 68 years old, who used ibuprofen daily to relieve knee pain. During a routine checkup, we discovered her blood pressure had risen to a dangerous level, and her blood tests showed signs of abnormal clotting. If she had continued using NSAIDs for a long time, her stroke risk would have increased significantly. We worked together to find safer alternatives, and the results were remarkable. One safer alternative was switching to acetaminophen. This medication does not affect blood pressure or clotting as much, making it more suitable for older adults. However, acetaminophen must also be used at the proper dosage to avoid liver issues. Along with that, I always recommend patients add anti-inflammatory foods to their daily diet, such as salmon, walnuts, olive oil, dark leafy greens, and berries. A proper diet not only helps relieve pain naturally, but also supports cardiovascular and brain health, which are both vulnerable to high blood pressure and stroke. The key here is awareness. Many people still believe that pain relievers are harmless, but that is not true. Understanding how NSAIDs work and the risks they pose helps you make smarter decisions, using them at the right time, at the right dose, and, when possible, finding safer alternatives. This is an important step to protect long-term health, especially as we enter our 60s and 70s. I want to emphasize that not all older adults must completely avoid NSAIDs. In some cases, doctors may still prescribe them when the benefits outweigh the risks. What matters most is close health monitoring, regular blood pressure checks, and coordination with your doctor to adjust the dosage as needed. And here is the message I want to leave with you. If you use non-steroidal anti-inflammatory drugs frequently, consider making a change. You can switch to acetaminophen or combine your medication plan with an anti-inflammatory diet and other natural health practices. Even a small change can help reduce stroke risk, protect your heart, and improve your quality of life. Remember, your health is your greatest asset. When you understand what you put into your body, from medications to food, you truly gain control over your own risks. Do not let familiar medicines become hidden dangers. Talk to your doctor about your use of non-steroidal anti-inflammatory drugs. A small change today can make a big difference tomorrow. And if you find this information valuable, please subscribe to the channel and share this video so more people can learn how to protect their health, especially the loved ones in your family. Consider replacing non-steroidal anti-inflammatory drugs if you use them frequently, and care for yourself wisely. 2. SSRI antidepressants. Be careful when combined with aspirin. When talking about mental health in older adults, we cannot ignore the group of antidepressants known as SSRIs, such as Zoloft, Prozac, or Celexa. These medications are very common and often prescribed to relieve symptoms of depression, anxiety, or other mental disorders. In many cases, they truly improve mood and enhance quality of life. But from my years of experience working with people over 60, I have noticed that not everyone is aware of the potential risks these drugs pose to heart and brain health. One of the most critical issues is that SSRIs can increase the risk of brain bleeding, especially if combined with aspirin or other blood-thinning medications. This situation is not rare. Many older adults take aspirin daily to prevent heart attacks or strokes, while also being prescribed SSRIs to improve mood. The combination may seem harmless, but can actually lead to brain bleeding, a dangerous type of stroke that often leaves lasting consequences. I remember one patient, Mr. Robert, 72 years old, who took Zoloft to treat depression after his wife passed away. He also took daily aspirin for heart health, a habit common among people his age, when he experienced a severe headache accompanied by dizziness. We hospitalized him for examination. The results showed a small brain bleed that, thankfully, was detected in time. This incident served as an important reminder that understanding how medications work and how they interact is essential, especially as we age. So how can you maintain mental health while reducing risks? One solution I often recommend is combining medication with natural approaches and healthy lifestyle habits. Gentle daily exercises, such as walking, yoga, or stretching, can reduce depression symptoms while improving circulation and heart health. In addition, therapy, meditation, or social support groups can help relieve stress and boost mood, sometimes reducing the need to increase SSRI dosage. One important point I want to emphasize is that you should never stop or change your medication dosage on your own. Suddenly discontinuing SSRIs can cause unpleasant withdrawal symptoms such as insomnia, anxiety, fatigue, or worsening of psychological conditions. Instead, always discuss safe options with your doctor, such as dosage adjustments, alternative medications, or additional non-drug therapies from a professional perspective. I find that many older adults do not pay enough attention to drug interactions. They focus only on the main effects, like reducing depression or relieving pain, while overlooking the hidden risks to the heart, blood pressure, or brain. Understanding drug mechanisms and interactions will help you make safer choices and significantly reduce long-term health risks. To illustrate, I often share with patients the types of foods and habits that support brain and mental health. For example, eating berries, salmon, walnuts, staying hydrated, maintaining regular sleep patterns, and engaging in positive social activities. These factors, when combined with SSRI antidepressants, can produce a balanced effect, protecting both mental and physical health while reducing the risk of complications like brain bleeding or stroke. In conclusion, SSRIs are powerful tools for improving mental health in older adults, but they are not without risks, especially when combined with aspirin or blood thinners. The likelihood of brain bleeding and stroke increases significantly. My advice is this: understand how these drugs work. Monitor your health regularly. Combine physical activity and therapy. And always consult your doctor before making any medication changes. If you are taking SSRIs and also using aspirin or any heart-related medication, reconsider and talk to your doctor today. A small decision today could save you from a major risk tomorrow. 3. Sleeping pills. Benzodiazepines. Easy sleep, but a weary mind. Sleep is always one of the most essential factors for maintaining health, especially for people over 60. Many of my patients often complain that they have trouble falling asleep, wake up during the night, or do not feel rested even after lying in bed all night. In such cases, doctors often consider prescribing sleeping pills from the benzodiazepine group, such as Xanax, Valium, or Ativan. These are common medications that help one fall asleep more easily, reduce anxiety, and bring immediate relaxation. However, from my many years of working with older adults, I have observed that benzodiazepines carry risks that many people may not recognize. One of the most important issues is reduced brain circulation. The active ingredients in these drugs can slow blood flow to the brain, limiting oxygen and nutrients from reaching brain cells. Over time, this can affect memory, concentration, and sometimes increase the risk of cognitive decline. The second risk is an increased likelihood of falls. When using benzodiazepines, the body becomes overly relaxed, reflexes slow down, and balance decreases. This is particularly dangerous at night when one needs to use the restroom or stands up suddenly. Falls in the elderly do not only cause bruises, but can also lead to hip fractures, head injuries, or other serious complications. I remember one patient, Mrs. Helen, 68 years old, who had been taking Ativan for several months to sleep better. At first, everything seemed fine. She slept deeply and woke up less often. But after a few weeks, she began feeling tired in the morning. Her memory declined, and one day she fell in the bathroom. Fortunately, there was no fracture. But that incident was a clear reminder that easy sleep through medication does not equal safe health. So how can we improve sleep while reducing risks? I always emphasize that good sleep does not come only from medication. One of the most effective methods is meditation and relaxation techniques before bedtime. Just a few minutes of meditation each evening can calm the mind, steady the heartbeat, and help the body drift into sleep more naturally. In addition, melatonin, a natural hormone in the body, can help regulate the sleep cycle. In proper doses, melatonin helps one fall asleep without reducing brain circulation or increasing the risk of falls like benzodiazepines. However, as with any medication or supplement, one should consult a doctor before use. Improving sleep habits is also a key factor. Maintain consistent bedtime and wake-up hours. Avoid using phones or watching television right before sleeping. Keep the bedroom quiet and dark, and avoid caffeine or sugar too late in the evening. When combined with meditation or melatonin, these habits are sometimes more effective than strong sleeping pills. In practice, I have seen many older adults become dependent on benzodiazepines without realizing their long-term risks. Understanding how they work and their side effects helps you make wiser choices to sleep well while protecting your brain and preventing falls. Benzodiazepine sleeping pills may bring instant sleep, but also pose hidden dangers of reduced brain circulation and falling. The advice is to use them only when truly necessary. Combine them with meditation, melatonin, and healthy sleep habits. And always consult your doctor about proper dosage and duration. The decisions you make today can protect your brain and physical health for years to come. 4. Cholesterol-lowering drugs, statins. A healthy heart, but handled with care. When it comes to heart health in older adults, most of us know that high cholesterol is one of the leading risks for stroke and heart attack. That is why many people over 60 are prescribed cholesterol-lowering drugs known as statins, such as atorvastatin or simvastatin. These familiar medications have been proven to reduce bad cholesterol, stabilize blood vessels, and protect the heart. However, through years of experience working with older adults, I have found that statins also have side effects that are often overlooked. One of the most common issues is muscle weakness. When taken at high doses or for extended periods, the body can react by reducing muscle strength, causing fatigue or unexplained soreness. For people over 60, this not only causes discomfort, but also increases the risk of falls, especially when walking or climbing stairs. Another risk that few notice is the potential effect on brain circulation. Statins work by acting on blood lipids, reducing bad cholesterol, but possibly also altering blood flow to certain areas of the brain, particularly in older bodies with weaker circulation. This does not happen to everyone, but for those on high doses, long-term regimens, or combinations with other medications, it is a risk that must be carefully monitored. I recall a patient, Mr. Robert, 67 years old, who used high-dose atorvastatin to manage his cholesterol. At first, everything went well. His cholesterol levels dropped, blood vessels stabilized, and his heart grew stronger. But after a few months, he began feeling his muscles weaken, had trouble walking, and occasionally slipped. Fortunately, this was detected early through regular muscle enzyme tests, and his doctor adjusted the dose and combined it with gentle exercise. Everything then returned to normal. So how can we maintain the benefits of statins while minimizing risks? First, regular muscle enzyme tests are essential. These tests can detect early muscle issues, allowing doctors to adjust dosage appropriately. Second, gentle and consistent exercise helps maintain muscle strength and balance. Walking, yoga, or stretching exercises are simple but effective ways to prevent weakness and reduce fall risk. In addition, maintaining a balanced diet is also vital. Increasing the dose of medication is not always the best way to reduce cholesterol. Vegetables, nuts, fish rich in omega-3, and limiting foods high in saturated fats can all help support the effects of statins, while easing the body's load from prolonged high doses. From a professional perspective, I want to emphasize that statins are important medications, but they are not without risks. Understanding how they work, recognizing side effects, and combining them with a healthy lifestyle will help you protect your heart while maintaining muscle strength and brain circulation. Being mindful and cautious today can help you move freely and live actively for years to come. Statin cholesterol lowering drugs clearly show that every medication has two sides: the ability to protect health and the potential for harm if not used wisely. Use them as prescribed. Test your muscle enzymes regularly. Exercise consistently and maintain a healthy lifestyle. That is the safest balance between a strong heart and an agile body, avoiding falls and protecting brain function. 5. Thyroid medication. Levothyroxine. Balancing hormones, keeping the heart steady. When we talk about the health of older adults, we cannot overlook the vital role of the thyroid gland. Thyroid hormones affect nearly every function in the body, from metabolism and energy to heart rhythm and circulation. Among people over 60, hypothyroidism is quite common, and supplementing with levothyroxine is the standard treatment. Levothyroxine helps the body maintain stable thyroid hormone levels, thereby improving energy, mood, and overall well-being. However, from years of experience, I have seen that dosage is the key factor. If the dose is too high or adjusted improperly, the body can respond with irregular heart rhythms. Episodes of rapid heartbeat, palpitations, or fluttering can develop quietly, and in older adults, these issues can increase the risk of stroke or other heart problems. Another lesser known fact is that excessive doses of levothyroxine may increase the risk of blood clots. When thyroid hormone levels become too high, they stimulate the circulatory system, making blood more prone to clotting, combined with other age-related factors, such as high blood pressure, arteriosclerosis, or inconsistent use of anticoagulants. The risk of stroke rises significantly. That is why I always remind my patients that levothyroxine is not a pill to be taken by routine. It must be carefully monitored and adjusted. I remember one patient, Mrs. Margaret, 6 to 8 years old, who had been using levothyroxine for more than a year to treat hypothyroidism. At first, everything was fine. She felt more alert, had better energy, and slept more soundly. But after a few months, she began noticing an unusually fast heartbeat, occasional anxiety, and mild shortness of breath. When we checked her TSH levels, we found that her dosage needed to be reduced by half. After adjusting the dose, her heart rhythm returned to normal, and the risk of clotting decreased. This experience reminds us that regular TSH testing and listening to your body are extremely important. So how can you use levothyroxine safely and effectively? First, check your TSH levels regularly. This is the most accurate way to know whether your thyroid hormone levels are balanced or too high. Second, adjust your dosage under medical supervision. Do not increase or decrease the dose on your own, even if you feel better. And finally, pay attention to your body. Any sign of rapid heartbeat, palpitations, or unusual fatigue should be reported to your doctor immediately. In addition, a healthy lifestyle supports the effectiveness of levothyroxine. A balanced diet, reduced cholesterol intake, gentle exercise, and proper rest help stabilize the cardiovascular system while optimizing thyroid hormone function. From a professional perspective, I emphasize that levothyroxine is a lifesaver for many people with hypothyroidism, but it must be treated with respect. Understanding how it works, monitoring TSH regularly, and maintaining the right dosage are the safest ways to gain its benefits, while minimizing risks like irregular heartbeat or blood clot formation. Like many other types of medication, levothyroxine shows that effectiveness always comes with responsibility. Older adults need to work closely with their doctors, listen to their bodies, and maintain a healthy lifestyle so that thyroid hormones improve health rather than create unwanted risks. This balance not only strengthens the body, but also keeps the mind clear, the heartbeat steady, and blood circulation strong, all essential for staying active and safe beyond the age of 60. 6. Anticoagulant medication. Warfarin. Balancing the blood, preventing stroke risk. When we talk about medications that protect cardiovascular health, Warfarin is always a prominent name. This anticoagulant is commonly prescribed for people at high risk of developing blood clots, such as those with atrial fibrillation, artificial heart valves, or a history of stroke. Yet, from my practical experience, Warfarin can be a double-edged sword. The mechanism of Warfarin is simple yet sophisticated. It thins the blood, reducing its ability to form clots, thereby lowering the risk of stroke caused by blocked vessels. It sounds ideal, but if not tightly controlled, overly thin blood can cause bleeding, particularly in the brain. Even a small bruise or a minor fall could result in internal bleeding, which can be life-threatening. On the other hand, if the dosage is too low or the body does not absorb the drug evenly, the blood may remain too thick, allowing clots to form and leading to the very stroke we aim to prevent. From a professional standpoint, I always emphasize that Warfarin is not a medication to be taken out of habit. It requires regular monitoring through a test called the INR, International Normalized Ratio. This index shows whether your blood is too thin or too thick, allowing the doctor to adjust the dose properly. I once treated a patient, Mr. Robert, 72 years old, who used Warfarin after an episode of atrial fibrillation. At first, he increased his dose on his own, thinking it would protect his heart better. The result was an excessively high Indian rupee, and he began showing minor bleeding under the skin. Thankfully, it was discovered early during a routine check. This story proves that Warfarin is only safe when dosage is personalized and carefully monitored. Beyond Indian rupee monitoring, diet also plays a major role in Warfarin's effectiveness. Foods rich in vitamin K, such as spinach, broccoli, and water spinach, can reduce the drug's anticoagulant effect if consumed too suddenly or in large amounts. Conversely, eating too little vitamin K can make the blood overly thin. Therefore, maintaining a balanced and consistent intake of vitamin K is crucial. There is no need to avoid these foods entirely. Just keep your diet steady, so the body and the medication can work together effectively. People using Warfarin must also pay close attention to other medications and supplements. Certain antibiotics, non-steroidal anti-inflammatory drugs, NSAIDs, or herbal supplements can increase or decrease Warfarin's effects. That is why every time you receive a new prescription, you should inform your doctor or pharmacist to avoid unexpected interactions that may make the blood too thin or too thick. From a professional perspective, I always remind patients that Warfarin is one of medicine's greatest inventions for preventing stroke, but it is not an absolutely safe drug. Understanding its mechanism, monitoring Indian rupees regularly, maintaining a balanced diet, and checking for drug interactions will help you gain its benefits while minimizing risks. For people over 60, this is even more important. Aging comes with changes in liver, kidney, and circulatory function, so personalizing the Warfarin dose helps not only protect the heart, but also prevents stroke and brain hemorrhage. Remember, Warfarin can be your ally, but only if you understand how to adjust, monitor, and coordinate it with your body. When used correctly, it allows you to live healthily and actively while reducing stroke risk. That is the ultimate goal every older adult strives for. 7. Diabetes medication. Sulfonylureas. Controlling blood sugar. Preventing stroke risk. When it comes to diabetes management, especially for those over the age of 60, sulfonylureas are among the medications many people have heard of. Names such as Glyburide or Glyburide are commonly prescribed to lower blood sugar, control glucose levels, and reduce long-term complications of diabetes. It sounds reassuring, but from my years of experience with older patients, sulfonylureas also carry hidden risks that are often overlooked. The mechanism of this medication is to stimulate the pancreas to release more insulin, thereby lowering blood sugar. However, the issue is that, if not closely monitored, excessive insulin can cause blood sugar to drop too low, a condition known as severe hypoglycemia. When blood sugar falls too sharply, the body enters a state of stress, heart rate rises, blood pressure fluctuates, and the risk of stroke, cerebral infarction, or oxygen deficiency in the brain increases significantly. From a medical perspective, I want to emphasize that hypoglycemia is not just a number on a glucose monitor. In older adults, a severe hypoglycemic episode can cause irregular heartbeat, reduced cerebral circulation, or even serious falls. I remember one patient, Mrs. Linda, 6 to 8 years old, who had been on Glyburide for years. One morning, after eating less than usual, she felt weak, dizzy, and almost fell. Fortunately, her family noticed early and monitored her blood sugar regularly, preventing serious complications. This story illustrates that sulfonylureas can be beneficial, but only when managed carefully and monitored consistently. Today, medicine offers safer alternatives for older adults. Drug classes such as DPP-4 inhibitors or GLP-1 agonists do not cause severe hypoglycemia like sulfonylureas and help maintain stable blood sugar while reducing cardiovascular risk. This is why I often advise my patients to consider switching to these options, especially if they have a high risk of stroke or have previously experienced hypoglycemic episodes. Beyond medication changes, home blood sugar monitoring is extremely important. Older adults should measure their blood sugar regularly and record the results so doctors can adjust dosages accurately. Consistency in diet, eating full meals and maintaining snacks rich in protein and fiber also helps prevent sudden hypoglycemia. I always remind patients that diabetes management is not just about medication. Gentle exercise, walking, yoga, and maintaining a healthy weight are crucial factors in reducing stress on the body and supporting stable circulation. Combining a healthy lifestyle with safe medication greatly reduces the risk of stroke and cardiovascular complications. Another important point often overlooked is drug interaction. Sulfonylureas can interact with many other medications, from cardiovascular drugs and antibiotics to dietary supplements. Therefore, every time a new prescription is given, it is essential to inform both the doctor and pharmacist to prevent sudden hypoglycemia or increased stroke risk. From my point of view, sulfonylureas are like a double-edged sword. When used correctly, they help control blood sugar and prevent diabetic complications. But when misused or poorly monitored, the risk of stroke increases sharply. Understanding the mechanism, choosing the right medication for one's age and health condition, and combining it with a healthy lifestyle are the keys to staying safe and healthy in the long term. Finally, my message to everyone over 60 is this: do not focus solely on lowering blood sugar immediately. Look at the bigger picture of health. Safe blood sugar control, stroke prevention, a balanced lifestyle, and close monitoring are the keys to living a healthy and fulfilling life in your later years. 8. Hormone replacement therapy, HRT. Balancing hormones, staying cautious. As women enter menopause, the body undergoes significant changes. Many experience fatigue, insomnia, hot flashes, and constant mood swings. In such times, hormone replacement therapy, or HRT, becomes an option many consider to balance hormones and relieve uncomfortable symptoms. Yet from a specialist's perspective in elderly care, I want to share that HRT also carries potential risks that must be understood. HRT often includes estrogen or a combination of estrogen and progesterone. When used properly, it can improve sleep quality, reduce hot flashes, and stabilize mood. However, according to multiple studies and my clinical experience, HRT can increase the risk of blood clots and high blood pressure, particularly in women over 60 or those with a history of heart disease. This risk is not theoretical. I recall a 65-year-old patient, Miss Margaret, who started HRT to ease hot flashes. Within a few months, she experienced dizziness and high blood pressure, and doctors detected early signs of small blood clots. Thankfully, with close monitoring, serious complications were prevented. The underlying mechanism is clear. External hormones alter the body's clotting process, promoting platelet formation and making the blood more prone to clotting. Estrogen can also affect the cardiovascular system, raising blood pressure and thereby increasing the risk of stroke or brain infarction if not carefully monitored. This is why I always stress that HRT is not a one-size-fits-all solution for every older woman. What, then, is the solution? First, If HRT is chosen, use the lowest effective dose and avoid unnecessary long-term use. Regular blood pressure checks, blood tests to assess clotting function, and consistent communication with healthcare providers are vital. Hormonal options should also be considered. Certain medications can help with menopausal symptoms, while a diet rich in phytoestrogens from soy, flaxseed, or natural herbs can help reduce hot flashes and stabilize mood without increasing clotting risks. Beyond medication, a healthy lifestyle plays an essential role. Light exercise, walking, yoga, or meditation improves circulation, lowers blood pressure, and enhances overall well-being. Getting sufficient and regular sleep, along with a diet high in vegetables, fruits, and whole grains, and low in salt and processed foods, helps reduce cardiovascular stress and lowers the risk of complications. From my real-world experience, HRT must always be personalized. Not all women respond the same way. Age, cardiovascular condition, blood pressure, and medical history of stroke or clotting all influence which therapy and dosage are appropriate. Physicians carefully evaluate these factors to ensure safety and effectiveness, avoiding preventable risks. From a professional standpoint, the key is not to fear HRT, but to use it wisely, understanding its mechanism, choosing the lowest dose, monitoring closely, and maintaining a healthy lifestyle are the cornerstones of balancing hormones safely while minimizing stroke risk. More broadly, HRT is only one aspect of elderly healthcare, paying attention to bodily signals, recognizing abnormalities early, living healthily, and having regular medical checkups are what truly sustain long-term well-being and prevent unnecessary risks in the journey of self-care after 50. Understanding correctly, using wisely, and monitoring consistently are the secrets to living a healthy, balanced, and peaceful life. 9. First generation antihistamines. Fighting allergies but carrying hidden risks. When it comes to allergy medications, many older adults immediately think of diphenhydramine, commonly known by its brand name Benadryl. This familiar medication has been widely used to relieve symptoms such as itching, sneezing, runny nose, and rashes. However, from my years of experience caring for older patients, not everyone realizes that these first-generation antihistamines can pose significant risks to cardiovascular and circulatory health. One common issue is that diphenhydramine can thicken the blood, raise blood pressure, and cause irregular heart rhythms. This is not rare, especially among those over 60 or those taking other medications that affect blood pressure or heart function. I recall one of my patients, Mrs. Helen, age 68, who took Benadryl every night to sleep better and reduce summer allergies. After just a few weeks, she began to feel her heart race, her blood pressure rose, and she felt more fatigued than usual. These were early warning signs of potential blood clot formation and even an increased risk of stroke if left unchecked. The mechanism behind this is quite clear. Older antihistamines have sedative and vasoconstrictive effects, and they also make the blood thicker. When the blood becomes more viscous and blood pressure rises, circulation to the brain and heart can be impaired, creating conditions that promote cardiovascular complications and stroke. This becomes especially dangerous when combined with underlying conditions such as diabetes, hypertension, or heart disease. So, what is the solution? First, we can switch to newer generation antihistamines such as loratadine or cetirizine. These options have minimal effects on heart rhythm and blood pressure, and do not thicken the blood as much as diphenhydramine. I always advise my patients that changing medications not only reduces the risk of complications, but also improves sleep quality and mental clarity, since these newer drugs cause less drowsiness and fatigue. Alongside medication adjustments, maintaining a healthy lifestyle is equally important to reduce adverse effects. Keeping blood pressure stable through a low salt diet, engaging in daily gentle exercise such as walking, yoga, or meditation helps improve blood circulation and overall well-being. Staying well hydrated also helps maintain normal blood viscosity and reduces the risk of clot formation. Additionally, pay close attention to warning signs such as dizziness, rapid heartbeat, fatigue, or fainting. From my experience, many older adults underestimate the risks of long-term diphenhydramine use without monitoring, which can lead to serious complications. Regularly checking blood pressure, heart rhythm, and circulation status is the best way to prevent these risks. From a medical perspective, I want to emphasize that it is not necessary to completely avoid antihistamines, but understanding how they work, choosing safer, modern options, and maintaining a healthy lifestyle are the keys to controlling allergies while protecting both heart and brain health. In reality, when older adults change their medication habits and opt for safer alternatives, they not only reduce their risk of stroke, but also improve their overall health, enjoy better mood stability, and face fewer unwanted complications. Smart choices and careful monitoring will help us maintain an active, healthy, and confident life after 60. 10. Older antiarrhythmic drugs, treating the heart but carrying hidden dangers. When it comes to heart conditions, especially arrhythmias, many older adults are familiar with medications like Amiodarone or Digoxin. These drugs have been prescribed for decades to help regulate heart rhythm, reduce palpitations, and control irregular or dangerous heartbeats. However, from my long clinical experience with elderly patients, these older antiarrhythmic drugs carry risks that cannot be ignored, particularly when taken at incorrect doses or used over long periods. One of the greatest dangers is overdose, which can lead to more severe arrhythmias, increased risk of blood clot formation, and even stroke. I once treated a 72-year-old patient, Mr. John, who had been taking Digoxin for years to control his heartbeat. Initially, his heart rhythm was stable, but in recent months he began to experience fatigue, dizziness, and irregular heartbeat. Upon testing, we found his drug level in the blood was far above the safe range, and his risk of clot formation in the heart had risen significantly. This clearly demonstrates that even familiar medications can cause serious complications if not closely monitored. The dangerous mechanism is well understood. Older antiarrhythmic drugs act directly on the electrical potential of the heart membrane to regulate rhythm. However, when blood concentrations become too high, they can cause the heart to beat more erratically instead of stabilizing it, while simultaneously increasing the risk of clotting. For older adults, especially those with conditions like hypertension, diabetes, or heart failure, this effect can be particularly dangerous. So, what can be done? First, it is important to switch to safer, newer generation antiarrhythmic drugs, such as modern beta blockers or rhythm stabilizers with fewer side effects, under the guidance of a cardiologist. From my experience, when patients transition to safer medications, most maintain stable heart rhythms with far fewer complications. Regular heart monitoring is also essential. Using home heart rate monitors or undergoing periodic checkups helps detect early warning signs, allowing timely medication adjustments. I often advise patients to keep a heart rate diary, noting symptoms such as dizziness, fatigue, or palpitations, so their doctors can make well-informed treatment decisions beyond medication and monitoring. Lifestyle also plays a crucial role. A balanced diet, reduced salt intake, limited processed foods, and gentle activities like walking, yoga, or meditation help improve blood flow, stabilize heart rhythm, and lower the risk of clot formation. Staying well, hydrated, and maintaining good sleep quality also support the body's natural ability to regulate heart rhythm. From a professional standpoint, I want to stress that antiarrhythmic drugs should not be feared. However, understanding how they work, choosing safer alternatives, and maintaining close medical supervision are the keys to minimizing risks. When older adults follow these steps, they not only lower their stroke risk, but also maintain stable cardiovascular health, allowing for a more confident and active lifestyle. In conclusion, managing arrhythmia in older adults is not merely about taking medication. It is a process that combines knowledge, wise decision-making, and healthy habits. By understanding the hidden risks of older drugs like Amiodarone and Digoxin, and by making proactive changes and monitoring closely, we can live healthier, reduce complications, and fully enjoy the later years of life. I still remember very clearly a case that I personally cared for, and this story truly became a valuable lesson for all of us, especially for those over the age of 70. My patient, Mrs. Margaret, 72 years old. Lived alone in a small town in the United States. She used to be very diligent with yoga and morning walks, but as she aged, chronic conditions gradually appeared. Mrs. Margaret often suffered from joint pain, high cholesterol, and postmenopausal symptoms. Her doctor prescribed non-steroidal anti-inflammatory drugs to relieve pain, statins to lower cholesterol, and hormone replacement therapy to ease menopausal discomfort. At first, everything seemed fine. She continued her normal daily activities, sometimes felt mild fatigue but did not pay much attention. However, one morning, while preparing her coffee, she suddenly felt dizzy. Her heart raced, and she had shortness of breath. She called me, and through our conversation, I immediately recognized the warning signs. The combination of non-steroidal anti-inflammatory drugs, high-dose statins, and hormone replacement therapy had increased her risk of blood clots, high blood pressure, and potentially an immediate stroke. We asked Mrs. Margaret to come to the clinic immediately. Fortunately, she had not yet suffered a stroke, but her blood pressure was high, her heart rhythm was irregular, and her blood showed early signs of thickening. I explained to her that these medications, when combined, could create a domino effect. Non-steroidal anti-inflammatory drugs cause salt and water retention. High-dose statins weaken muscles and sometimes affect brain circulation. And hormone replacement therapy increases blood clotting and blood pressure. Each drug alone offers benefits, but when combined without careful monitoring, they can become a silent danger. The most important lesson from Mrs. Margaret's story is that awareness and vigilance can save your life. We immediately adjusted her treatment plan, reducing the non-steroidal anti-inflammatory drug dosage, switching to a more moderate statin level, and considering stopping hormone replacement therapy or replacing it with a non-hormonal alternative. She was also guided to monitor her blood pressure at home, check her heart rate regularly, and maintain a daily health journal. At the same time, she focused on an anti-inflammatory, plant-based diet, reduced salt intake, and practiced light exercises such as yoga and walking. After a few weeks, Mrs. Margaret's condition improved significantly. She felt stronger, more optimistic, and, most importantly, realized that she had avoided a dangerous stroke because she understood her medications and monitored her health carefully. The message I want to share with everyone, especially those over 60, is this. Understanding how your medications work is not just knowledge. It is the key to preventing health disasters. You do not need to fear medications, but discussing them with your doctor, undergoing regular checkups, and making timely adjustments are the only ways to live safely and proactively. Mrs. Margaret's story also reminds us that even if you lead a healthy lifestyle, exercise regularly, and eat scientifically, medications can still strongly affect your health if you do not understand their mechanisms or combine them incorrectly. Therefore, learning to read medication labels, asking your doctor about drug interactions, and noting daily symptoms are extremely important. Imagine that just on an ordinary day, an incorrect drug combination or lack of monitoring could turn into a health disaster. Fortunately, Mrs. Margaret avoided it through awareness and action. This story reminds us all that your health is your most precious asset, and understanding is the most powerful weapon to protect it. So whenever you use any medication, especially non-steroidal anti-inflammatory drugs, statins, or hormone replacement therapy, remember that it is not only about taking them on time, but also about understanding their mechanisms, observing their effects, and making adjustments when needed. By doing so, you can enjoy a safe, healthy, and vibrant older age, while avoiding risks such as strokes or other serious complications. Looking back at everything we have explored together, you can clearly see that medication use is far from simple, especially once you reach 60 or beyond. In today's video, we have discussed 10 common drug groups frequently used by older adults, which may increase the risk of stroke if not monitored carefully. From non-steroidal anti-inflammatory drugs that cause salt and water retention and increase blood pressure and clotting risk, to selective serotonin reuptake inhibitors that may increase brain bleeding risk, or benzodiazepines that reduce brain circulation and increase fall risk. We also discussed statins that can weaken muscles and affect brain circulation when used at high doses for a long time. Thyroid medications like levothyroxine that, when overdosed, cause irregular heart rhythms and clotting risk. Warfarin, a common anticoagulant that becomes dangerous when the blood is too thin or too thick. Sulfonylureas for diabetes that can cause excessive hypoglycemia. Hormone replacement therapy that increases blood clotting and pressure. Generation antihistamines that thicken the blood and cause irregular heartbeat. And finally, old antiarrhythmic drugs that, in high doses, can trigger irregular rhythms and clot formation. Each drug alone has its benefits, but when combined or taken without supervision, they form a frightening picture of risk. As Mrs. Margaret's story shows, understanding how medications work is the best way to prevent health crises. When you understand how drugs affect blood pressure, clotting, heart rhythm, or blood sugar, you know how to make adjustments, communicate with your doctor, and safely modify your regimen. So what should you do right now? First, check your medicine cabinet. Look closely at every medication you are taking, whether prescribed or over the counter, and ask yourself, are any of these among the high risk groups we discussed? Next, talk to your doctor or pharmacist to review dosages. Consider safer alternatives or include supportive measures like dietary changes, exercise, and regular monitoring. Remember that the risk of stroke does not come only from age, but also from the medications you take daily. Knowing your medications, understanding combinations, and making adjustments are the keys to protecting your health, maintaining mental clarity, and enjoying a fulfilling older age. Finally, I want to emphasize an important message, just a bit of proactivity. One conversation with your doctor and a proper understanding of your medications can significantly reduce your risk of stroke and other severe complications. This is not theory. It is reality that I have witnessed through many years of working with older adults. Small changes can make a great difference in your life and health. And to make sure you do not miss valuable information, share this video with your family and friends and subscribe to this channel today. By doing so, you will not only protect your own health, but also help raise awareness among your loved ones and the elderly community about effective stroke prevention. Remember, age is just a number. Your health depends on understanding, awareness, and wise daily choices. Turn every pill, every meal, and every habit into an opportunity to keep your heart and brain safe, strong, and full of life.